They had mentioned, I had heard them talking. They definitely knew there was heart inflammation. They did some more tests. And after doing some blood work, we knew he was not going into heart failure, but there was significant heart inflammation. They scheduled him for an echo and admitted him into on a cardiac floor, a tele floor.
And then how was he treated?
He was treated with colchicine, which is a medication you would normally think is used for gout, but it is actually also used for inflammation around the heart. And then once the chest pain had subsided and they realized he was stable, he was discharged from the hospital. He is still, that was in the beginning of May.
Yeah.
He's still on the colchicine. He'll continue on that for 3 more months. He'll have another echo next month and an MRI of his heart to see how much damage still remains.
Aiden, how are you feeling now?
I'm feeling pretty good. Chest pain has been absent mostly. I haven't felt anything much since the hospital checkup.
Your breathing's better.
Yes.
The first few weeks he came home, you could barely walk around the block without getting really winded.
Yeah.
But you're able to walk now and even mowing the lawn. And
yeah, it's pretty much back to normal now.
And Dina, when in this process did you know that it was related to his vaccine?
The physicians mentioned it right away because it was so soon after. At first, there was some thought that maybe there was lingering heart damage from when he had COVID in January, and maybe the vaccine amplified it. But now we're just being told it was vaccine related.
But we should also mention that despite this, did you hesitate to get your younger son vaccinated?
I did not. They had their first vaccines together, and then my younger son and my husband they went and got their second vaccine. No, I do kind of feel the only way we're going to get out of this pandemic is for everyone to be vaccinated. So I did think it was important.
But just so we're clear, Aiden can't have that second dose, right?
No.
Can he ever get the vaccine again if we do have to do follow-up vaccines?
No.
And what would you say to other parents who hear about this rare heart problem that's associated, I think, usually after the second shot?
He has recovered. They do not suspect that he's going to have any really long-term effects from it. It's scary, and I know that it's a hard decision, but the only way we're going to get out of this is for it's so hard. I know, I understand, but I don't regret getting vaccinated myself or having the rest of my family vaccinated.
Well, thank you so much for telling your story so that others could hear exactly what you went through. And again, Dina, you're making the point that even though you went through that, you still believe.
I do. I think it's the only way out.
Aiden, we wish you continued success in your recovery. Hope you're feeling better.
Thank you.
With me now to talk more about this issue is Aaron Carpenter. Aaron is a nurse practitioner with Nemours DuPont Hospital for Children in Wilmington. Aaron, thanks for being with us.
Thanks for having me.
So we know that federal health officials recently met to discuss this side effect of heart inflammation. What can you tell us about the results of that meeting?
So what we understand is that there's been approximately 1,000 cases of inflammation, myocarditis, which is an inflammation in the muscle, and pericarditis, which is an inflammation around the sac around the heart, out of the total 2021. And so while we see that as a concern and it's continuing to be monitored, it really is significantly less than actually the number of cases of heart inflammation that occur from COVID from COVID disease itself. So although that there is something that we're observing with this, the overall incidence of the inflammation cases is still a benefit to receive the vaccine rather than a risk.
And what do we know about recovery from this? Are the symptoms always mild? Are they the same for everyone?
Yeah, so what we know mostly is that it's affecting more boys than it's affecting girls, and that most kids who are coming down with the inflammation process are resolving very, very well with no significant impacts.
Now, doctors believe the young man that we talked to before who developed heart inflammation is pretty well protected against the virus because he had the first vaccine and the fact that he had COVID over the winter. But for others who have suffered this side effect, likely won't be able to get a booster shot if that's necessary, right? Will they be at risk? Will they continue to be at risk?
They may. So what we also know is that the vast majority of cases of inflammation that we've seen have come after the second shot, so they will have received most of the vaccine dose. And so I think most kids will still continue to be protected. We do know that 2 doses is better than 1 in terms of the coverage or building the antibodies for protection against the disease. But again, most kids will have received 2 doses.
Aaron Carpenter, nurse practitioner with Nemours DuPont Hospital for Children. Thank you so much for adding perspective for us.
Thanks again for having me.